Yeah.
Okay, shall we start then? So, welcome everybody. Great to see so many people here. My name's Chris Edge, for those who haven't met me. I'm chairman of the Raynes Park Association, which is an association of residents, associations and local businesses. Although we don't have that many businesses at the moment, we need some more. I'd like on this occasion to say a goodbye to two people, Peter Fisher and Jane Plant. They've been very involved in the community, but I think they're moving to North London to be with Jane's daughter, is it, Jane?
Yes, yes, grandson.
Grandson, yeah. So can't blame her for that, but Jane has been a tree warden for I don't know how many years, as long as I was a councillor, so that's probably getting on for 20 years, is it, Jane?
More.
And Peter Fisher as well has been a stalwart of the Raynes Park Association and the local community. So I'd just like to record a big thank you to both of them and wish them a happy second retirement in North London.
Yeah.
Thank you very much indeed, Chris. I didn't expect that.
It's always nice to have a surprise, isn't it? I'm particularly grateful for Phoebe Wright, Dr. Phoebe Wright and Jenny Kay for joining us tonight. I think you'll find that it's quite an interesting session, and I urge everybody to take particular note, whether you're young or old, and make some plans for the future in case the worst happens, or sorry, when the worst happens, because as you probably know, there's only two things in life for sure, and that's death and taxes. So I'm hoping to avoid paying my last tax bill when it happens to me, but we'll see what happens. Anyway, I'm also pleased that we have Nick McLean tonight, and I do apologize to Nick. I spelled his name wrong on the agenda and no one picked it up until Nick noticed today. But I'd like to hand over now to Nick, if I may.
Okay, thank you very much, Chris. Okay, yep, so as Chris just said, Councillor Nick McLean, quick introduction for myself. I represent the ward of Cannon Hill. I'm also the leader of the opposition on Merton Council. And I also noticed that tonight we're actually joined by some of my councillor colleagues. We have Stephen Crow, Councillor Stephen Crow from representing Raynes Park, Councillor Anthony Fairclough in Dundonald Ward, Councillor Simon McGrath, also Dundonald Ward, and I have an apology for David Dean for lateness, who will join us later, and he also represents the Dundonald Ward. So look, welcome everyone tonight. Good to see you all. And on that note, I think we'll move to our second item on the agenda, which is the railway station street management and Raynes Park improvements item, and that is led by Chris Larkham and Tony Edwards. I believe there are two sub items here, parklets and Muriel. So over to Chris and Tony.
Hi everybody, good evening. Chris Edge says there's nothing more to say on the railways to Chris, to me. And I said, well, it's all the same old things. So I'll only spend a couple of minutes, but just confirming that we're still trying to get the kiss and ride sorted out. The responsibility for the kiss and ride is the workspace, the owners of the estate, the Rainbow Estate. And I am going to keep going on at that. And don't know if Neil's here tonight, Neil Milligan, I don't think he is. But I'm from the council, because I need to talk to Neil and say, look, how do we clobber them to fulfill their responsibilities? Because at the moment it's a free-for-all and it's totally unhelpful. The embankment, particularly on both sides, are a mess. On our side, being the south side, how do you know which is our side, but it's the south side, rubbish by the bus stop there that just gets chucked over. And Network Rail said they would clear it and they haven't. And on the north side, they for years said they're looking for permission for us volunteers to go on there and manage it, and they can never sort out this permission. You know, I mean, government are getting rid of Network Rail and calling it Great British Railways. Do you think it's going to be any better? You don't have to vote because I can guess how you'll vote on that one. But we'll keep going. So that is that on that. And we're going to talk, Chris, aren't we, about the mural and the parklet later on? Is that right? Or do you want me to start on it? Sorry, I'm talking to Chris Edge, and it's not, and you're not there, I know.
It's up to Nick, but when we talked to Nick, we had it under this item.
Yes, so parklets and more murals. So, Chris, would you like to speak on parklets, or is Tony going to speak on it? The item.
I can say something about the parklet as far as I know it. I mean, it's almost like two initiatives coming together, really, because the suggestion for a parklet was some sort of populist, a temporary one, that in its essence, and this was an idea that was started a couple of years ago, you cannibalize a few car parking spaces and make them sitting areas, etc. And they can provide an outdoor space if there's an adjoining cafe or restaurant that can make use of it overall. So it's early days overall. One of the suggestions is, obviously, we've got a bit of potential space at the end of a skew arch. The issue where we've probably got some negotiation to do is that if you know that the skew arch area has got a dual carriageway, but it's also got a bus stop as well, where the buses park up. It's an easy space to take over, as it were, but you'd need Transport for London to forego parking their buses there, which, when we've tried it before as an approach to create a marketplace, the question was sort of, what's the question? The answer is no. There are 3 parking spaces for buses around Raynes Park, which is probably quite a bit compared to some other locations. So if we could actually advance the idea of the parklet by having TfL forego their parking space, then we've got a real opportunity. So I think it's all hanging in the balance, because that's the only area so far that we've ever discussed as a potential parklet. I don't know of anywhere else conveniently where you could take out a chunk of highway and create a parklet as well. So although there are ideas that can be put forward, I think that's the one that's got most legs to it, because we've already improved the area. We've got the green seats, there's grass there. It would be a logical way of providing some enhancement to the public realm. But we really need to actually try and lean on TfL to say, just give up parking your bus there for 3 months or 4 months or something. It's not forever. Mind you, the argument is, once you prove you don't need the bus lane for 3 or 4 months, you've got a much better case for getting rid of it and doing a marketplace in the long term. So they might be aware of that. But anyway, if we could first approach it as a temporary change, I think there's a real opportunity there. So we're trying to collaborate and see what we can do to bring that forward.
Okay, thank you, Tony. Is there any questions for Tony or councillor, or any councillors or anyone would like to comment on that particular item or that idea? I think the danger, TfL, we've all tried to work with TfL before, never easy. And I know that parklets have become a very good idea for social distancing, certainly prior to opening up for after the pandemic. Any questions or anything on that item? Yes, Matthew Willis.
Thanks, Nick. I just wanted to just put on the record that we have heard from Future Merton on this. So Sarah Xavier got in touch with the Raynes Park Association, and I've just been on site with both gentlemen that are on this agenda item, just to confirm that the desired endgame is for some outdoor dining and seating there. So what they're hoping to achieve is to have an opportunity for local businesses to set up like a coffee van, like the recent one in Don Donald Rec, or a food truck to create a bit of a destination space for that side of the railway.
Yeah, I've had conversations with them with regard to Morden, so it's not Raynes Park. Yeah, that's quite an exciting idea, just how to make use of those spaces. Any further questions on that item?
Only I suppose it's linked. Chris, you're going to speak about the mural, or Matthew, you'll speak about the mural, because I mean, there's 2 enhancements potentially going together, really.
Okay, thank you, Tony. Matthew or Chris, which one would like to speak on the mural?
Matthew, would you like to go ahead?
Sure. So the only reason that I'm doing this is because my boyfriend and I made the original suggestion on Nextdoor back in March, for which Councillor Dean and Councillor Fairclough offered assistance for us, which was brilliant on the mural. Councillor Fairclough followed this up by introducing me to Chris Larkman, and after a Zoom call with National Rail and a site visit in Raynes Park, I was happy to lead, having slightly more time to volunteer. So what we've done is we've come up with 2 designs. We've run a poll on Nextdoor, which has had 200 votes. Obviously not everyone is on Nextdoor, so I'm just going to hold up 2 images, if I'm allowed, to show you the 2 designs, just so that they're on the, if anyone wants to look at them on YouTube. That was one design, and this was the other design. There was a bit of questioning about SW20 versus Raynes Park, but just to put it on the record as well, Network Rail have the final decision. They are funding it, and it is their wall. So I think Chris is going to run a poll for local residents, but it will be Network Rail's decision.
Thank you. Yes, and that's really brilliant news, because we were looking years ago to have some sort of graffiti artist working in that skew arch, which needs something to liven it up, and it never came off. So it's really brilliant that Matt and Jules have made a move on that, and we've got a small grant from Network Rail, one thing they've done right. So let's watch this space. And also the Parklet initiative seems really brilliant. And bit by bit, hopefully we'll enhance and increase that area to make it part of the public domain, which would be brilliant. The only other thing I was going to say was, we're still going on about the piece of land at the south entrance of the station, and Network Rail have come back with more requirements for London Borough of Merton. It will happen before I go to my grave, I promise you. And it'll make the huge improvements for pedestrians at that point, if you know where I mean, as you go to the bus stop from the southern entrance to the station. So that really is all from me. Thank you, Nick.
Can I just add?
Any questions?
Can I just add to just what we've said, just put it in context? We've tried to get SIL money to create a permanent marketplace there, because it's the one place in Raynes Park where you can have an enlarged public realm and you don't have to demolish anything. You simply have less road and more pavement. So it's really helpful to be able to have these initiatives and bring life to an area, because Merton always used to say, well, prove if you make something, people will come, you know, make it and prove people will come. All of these initiatives will hopefully create more pedestrian traffic and excitement on that part of the railway area. And therefore, we've got a better and better case, hopefully at some stage in the future, for some form of permanent plaza area where various initiatives could take place. So it's all hopefully taking us in the right direction.
Thank you, Tony. Any other questions for Matthew for the design, on the design or the actual concept? No. Okay. On that note, then we'll move on to item 3, which is the planning update. Neil Milligan isn't joining us today. There's been no report prepared. Neil's actually leaving the council on the 1st of July. But there was nothing contentious, hence why there was no report made. But we are, of course, joined by Stephen Crow, Councillor Stephen Crow, who's the Vice Chair of the Planning Committee. So if there's any reports or any planning applications that are controversial or anything you'd like to ask, perhaps we could ask now, without delving too much into individual planning applications, that perhaps it could be taken offline with the relevant councillors. But anyway, Jill, Ray, I see you have your hand up. Jill, you're on mute. You'll have to come off mute.
Sorry. Okay, now.
Yes, go on. Go on.
Yeah. I just wanted to ask any update on the Manuplastics site.
Councillor Crow?
Well, I think the situation there is they have been granted planning permission for 160 flats, and it's up to the developer to progress it.
But it's been years on that desolate site, and we're desperate for housing.
Well, yes, but that's up to the developer. Obviously, the planning permission runs for 3 years. If they do nothing, then they have to reapply. But once planning permission is granted, it's kind of out of the council's hands.
Stephen, did you say 160?
Yes, I think that's correct, Michael.
So it's been extended from the original 95, I think it was.
Yes, I think that's the case.
And is that with no further parking?
Oh, I can't recall the detail. I would doubt whether there was additional parking. I would have thought it more likely that there would be no permits granted, but I'm not sure about the detail of that. I don't know if Anthony wants to come in. He's got his hands raised. As it's a Donald Ward matter, he might know something about it.
Anthony.
Thanks, Stephen. I was going to say my understanding on this was that there were applications to put in some extra flats in February 2020, which were actually turned down by the council. It was an attempt to add additional flats and remove the affordable housing element. And then earlier this year, there was an appeal to the planning inspectorate, I think in sort of January or February of this year, against the refusal of the application. So I believe, I mean, I've not seen the outcome of that, but I believe the developer is trying to, basically get some more kind of flats on the site, and the council had sort of turned the changes down, and I think that appeal is kind of working its way through. I could be slightly out of date. I haven't seen the appeal come through, but I think that's where it is.
Okay, thank you, Anthony. Any other questions?
Nick, it's Simon McGrath here. I'm pretty sure we've not seen the appeal come through, because we get them at the planning committee, as you probably know. So I would have noticed. I'm pretty sure we haven't had it. And what I can say is I'm sure that there wasn't any more parking spaces, because I remember looking at that. There were more flats, but the same number, or maybe one or two, but nothing significant. There's still going to be a problem with parking.
Thanks.
I objected to the original planning application. And as it stands at the moment, if it is the original one, I think it's only about 35 parking spaces for 95 flats.
Yeah.
Okay, thank you, Michael. Unless there's any other questions on that, we'll move on. Any other contentious planning items people would like to bring up? No.
Well, I just think that the one thing we need is affordable housing. It just seems crazy that you've got that site.
Well, but as Councillor Crowe said, the developer owns the land. It has got planning permission. It will be time limited, as is statutory. But until they want to improve on that, that's sort of out of the council hands at the moment. There's nothing really they can do.
Nick, can I ask a question about another issue? Nick?
Yes, you can.
Yeah, thank you. I was hoping to get a response to a question about the Hartfield Walk application, which I understand is going to planning committee shortly. But it was really to do with how can Love Wimbledon be so influential and take SIL money that is so desperately needed for something which is temporary and shoddy. And I'd like to know who in the council approves something like that, because it's a complete waste of money.
Okay,
it's Cabinet who approves SIL applications, isn't it? I think ultimately against the criteria.
Yes, that is correct. The officer will approve it. The SIL money has to go against a certain criteria. But I share your concerns, Jane, and I'm quite happy to look into that for you.
Please, if you would.
No problem. I'll do that. Okay, any other questions or anything to be raised on this particular item? If not, we will move on to item number 4, the optimal aging item, and we're going to now hand over to Phoebe and Jenny, Phoebe Wright and Jenny Kay, on this particular item.
Hi there, I'm Phoebe.
Hi.
Is it okay if we share our slides? I don't know if someone needs to give permission to do that.
Chris?
I'll do that from here, Jenny, and we'll do the Chris Whitty style. Next slide, please.
Would it be okay if we did it ourselves? Is that allowed or not really?
No, I have to hand over control and that gets a bit complicated.
Okay, we've changed them around slightly since we sent them, so we'll have to just bear with us.
Oh, okay.
So I'm Phoebe. I'm a palliative care doctor by background, most recently working at Trinity Hospice in Clapham, so your kind of neck of the woods almost. And this year, Jen and I are working as what's called Darcy Fellows, which means that we are learning about clinical leadership in the NHS. And as part of our project, we've been working with the Central London Community Healthcare team on a project to do with called optimal ageing, which we're going to elaborate a bit on today. Jen, do you want to introduce yourself?
Sorry, of course. Hello, everybody. My name's Jen Kay. I'm also a Darcy Fellow alongside Phoebe. I'm a physiotherapist by background. I live just down the road in Kingston, actually. So it's really nice to be working in South West London. I'll hand back to Phoebe to start off the presentation.
Thanks. Great. Next slide, please. So today we're going to cover a few things, and we've got time for 2 discussions on areas that Jen and I are working on. So we're leaving most of the time that we have to talk with you guys and see what your opinions are. So we're going to start off thinking about the case for change for the optimal ageing programme that we're working on, what we've been doing in Merton with some of the general practices in Merton. Then the 2 focuses, so that's planning for end of life, as Chris mentioned, and Jen's focusing on using digital technology for health. That's great. Next slide, please. So we've been looking at the health of the older population, which is on the top of many people's agenda for a number of reasons. And as you can see on this slide, if you focus on the right-hand side, that's the graph for Merton. You can see the population pyramid for 2020, and you can see the area in grey is the proportion of people that are over 65. So currently that's 12.9% of the population, so about 13%. But if you go to the next slide, you can see that area in the grey in that graph on the left has just expanded slightly. And actually what we know is, well, what they project is that by 2040, the proportion of older people over 65 will make up 18.6% of the population. So we're going from about 13% to about 19%, and the population is growing as well. So we've got a lot more older people to be thinking about as we go forward. Next slide, please. And on top of this, we know that the health of older people has deteriorated as a result of lockdown, which we refer to as an indirect result of COVID, so people not being able to get out and about. This is some research from Age UK that found that post-COVID, 1 in 5 people, older people, felt less steady on their feet, and 1 in 4 were unable to walk as far as they did before. And actually these statistics are taken after only the first lockdown. So actually we think the picture is probably a lot more concerning than this actually shows. So we're working with a public health doctor called Muir Gray. Next slide, please. And what we're hoping to work on is not increasing people's lifespan, so not trying to make people live longer, because I doubt anyone here wants to live to 150. What we're working on is increasing people's health span. So the bit of the life that's healthy, and decreasing that period at the end of life of dependency on other people. Next slide. And what Muir says is that there are only 2 phases in life biologically. A phase of growth and development, the up bit on that graph, then a turning point is reached. And from then on, it's downhill all the way. This turning point is normally reached in our 20s when we get desk jobs and become more sedentary. But before you get depressed, let me emphasize that the latest research makes it clear, next slide, that actually aging itself is not a cause of major problems until we're roughly in our 90s. The aging process affects everyone, and really picks up steam after the age of 40, but by itself does not cause major problems until after 90, although you do need a bit of luck. You need to be lucky enough to have been born into an area of less deprivation and higher education. And also you need to be lucky to avoid the diseases that we can't prevent. So for example, Parkinson's. So aging has got two principal effects. Firstly, the limitation in maximal level of ability. For example, the maximum pulse rate. And also aging affects the loss of reserve or resilience. So that's the ability to respond to a sudden demand, like a trip or a change in temperature or a period of inactivity, like a week in hospital or like the lockdown that we've all been through. Next slide, please. And you can see here, this graph is focusing on resilience. So what we know is that when people are younger and they have an insult to their life, so either a period in hospital, an illness or lockdown, we all take a dip in how resilient we are. But what we also know is that as people get older, we lose some of that resilience. And so actually the same insult can have a greater effect on what we're able to do. And therefore it can take longer to bounce back to our previous level. And in fact, we might not bounce back to how we were before. Next slide, please. Is this on to you, Jen?
Me, I think, yeah. So I get the nice bit and get to deliver some of the good news now that Phoebe's just depressed us all. Yeah, the good news is that we now know from all of the evidence and the scientific research out there that actually this sort of effects of aging that we've often attributed to what we think is aging are actually down to three things, and three things that we can affect. So those three things are loss of fitness, there's disease, some of which is not preventable, as Phoebe said, but some of which really is preventable. And a lot of disease is preventable through keeping fit. And the third thing is attitudes. So pessimistic beliefs, negative thinking, and also social factors and the culture that goes around that. So on this graph, I'd like to introduce you to something that we call the fitness gap. So this is the space, if you look at the two lines that are coming down from our mid-20s, as Phoebe was talking about, so when performance starts to decline, it's the space between those two lines that are coming down. And that's the difference in the ability or performance of people on the top line who have kept fit and who have kept active, and the bottom line, so people who have lost fitness. So that top line shows the best possible level of performance by people who've kept fit. So for example, I like to run, and so I had a look at the marathon world records, and the world record for 85-year-olds, and if any of you run, you'll know that this is impressive, for 26.2 miles is under 4 hours. It's 3 hours 56 for an 85-year-old. But I know that that's not most of our experience of people in their 80s, and certainly Phoebe and I, working within healthcare, often don't come across those people, and there's a reason for that. So often we're seeing people who are following that bottom line. So as Phoebe was saying, this loss of fitness not only reduces our maximum ability, but also our resilience. So that graph that she showed you with the dip that we've had in lockdown, so it dips further when we're following that bottom line, because it takes less to drop us further below that line of performance. And that's really similar to the effects of aging once we get to 90. So lots of people confuse, and this is health and social care professionals, us included, lots of people confuse the effects of loss of fitness with loss of aging, actually. And the good news is that any of us can get fitter at any point, and any of us can close that gap. So it will be harder for some, and it will be more challenging for some, and the ground that you can make up will be smaller for some, but everybody can make moves to lessen that gap. So the second thing that I talked about was disease, and I'm not going to talk about that in detail, but there are lots of diseases that we can avoid through keeping fit and through being active. And so I'm not biased just because I'm a physio. Phoebe's definitely on board with this, but the research and the science says that keeping fit and keeping active can prevent a lot of those diseases that make us follow that bottom line. So on to the third thing, which is attitudes and social factors. So negative and pessimistic thinking based on wrong beliefs can really impact on whether we follow the top line or the bottom line. And we need to think about changing our culture towards ageing and physical activity. And as a whole system, so all of the different organisations and businesses and healthcare providers and voluntary organisations across the areas that we live and work in, we really need to think about the kinds of things that we say and the attitudes that we have. And one of the ways that we want to try and do this is to try and help people understand that this decline in ability with increasing years is not inevitable, that we can influence it if we're lucky enough to. So what Muir says who we're working with is we need a cultural revolution. We need people to understand what's happening to ourselves. We need people to understand what's happening around you, and what the opportunities are to influence those three things that we've talked about, and what action they can take in order to help reduce those effects of following that bottom line. Next slide, please. So on the basis of all of that, we've got a programme that's called Optimal Ageing, and there's lots of different strands to it. And we're working in Merton and also in Wandsworth, but actually a lot of our work's been focused in Merton so far. And there are three strands to what we're doing. So there is optimal ageing content. So we're bringing together content and learning programmes to help people understand all the things that we've just talked about. The second thing, which we'll talk about in a little bit more detail in a minute, is the new digital platform called Wish. And we're testing this amongst Merton residents at the moment. And the third thing is that what we want to do is offering, as well as offering that coaching and that learning and understanding and knowledge to individuals, we also want to change the way that society and our system thinks and talks about ageing and growing older. So we're looking at setting up borough-based networks. So we're calling them Live Longer, Better networks of people around Merton who work with older people, and to try and start that cultural change. And all of these things are to try and help people live longer, better. So as Phoebe was saying, increase health span, to empower people and give people tools that they need to influence those three factors that we talked about, to change culture, to compress that period of disability and dependency that we have at the end of life. I think we looked at stats recently, and it's bad, actually. It's depressing, because that period of time that we spend at the end of life in ill health and being dependent on people is getting longer, and it should be getting shorter. So I think there's this sort of average stats. I think in Merton, in the more deprived areas of Merton, people are spending about 13 years of their life in ill health and dependency, and that's what we're trying to reduce.
Yeah.
And the idea behind that is obviously there's always a driver for it, but if people are living their life in a more healthy way and are less dependent and need less input, then we're reducing the need for health and social care. And we all know what the pressures are on our health and social care systems at the moment. So next slide, please. So we just wanted to mention a little bit more detail about this digital project that we're working on. And so we're working with a digital technology company to create a new digital platform. At the minute it's a website, but the idea is that it will be an app. And so WISH stands for the Wellness Interactive Support Hub. And it's a patient-facing website that we're going to use, and we are using, to share learning, support, resources and tools at the minute for older people. And when we say older people, that's, for some reason, everybody over the age of 65. That's how it's classified in the health and social care world. But there are, this could be used for any age group. We're just testing it with the older population at the moment. And it's to help them understand all those things that we've mentioned, and to give them tools so that they can manage their own health and be part of their own health and wellbeing management. It's been developed with NHS Digital, so it's been through lots of robust accreditation and checks and all sorts of processes. And the idea behind that is that people will be able to log in using their NHS login, which means that the system will link in with the GP records which, as some of you will probably know, that systems that talk to each other in the NHS are few and far between. So this is potentially something that can create a link between something that patients are using and entering data into and looking at, and people's own patient records. Next slide, please. So this is just some screenshots of some of the things that we got on there. So we've got, you might be able to make out Muir in the nice flowery shirt there. He's got a learning program, so lots of video content. We've got exercise programs that people can follow. We've included something called a wellness tracker. So people can record their own physical activity, how quickly they can walk a certain distance, how long they can stand and balance on one leg, how confident they feel in their ability to change, what mood they're in. And again, just to see how people engage with that. So it doesn't link with the GP record yet, but the idea is that that information would go through to the GP. Next slide, please. So just to summarise where we're at with our pilot at the minute. So it's Wandsworth and Merton, and we started in February with a really small prototype with a very small group of people, because it was at the very early stages of development, and we learned a lot from that. We asked people to use it, and we took some time to respond to all of that feedback and to make lots of improvements to it. And then in May, once we'd done all of that, we launched it with a number of GP practices that we're working with. So in Merton, at the moment, we're in particular working with Wideway and the Nelson practices. And we are aiming to get just under 400 people using the system for a period of time to see what I think about it, engage with the content. We've currently got, I think that number's increased actually as of today, hasn't it, Phoebe? So we're about 250. So it's a rolling recruitment period. We're hoping that we'll get to our 400 in the next 4 weeks. And we've got some really robust evaluation built into that. So we're working with a university team to understand things about how people engage with the system, whether it has any impact on behaviour or thoughts, and also we're looking at demographics. So the people that are taking this up, people in the least deprived areas, what about ethnicity? So we are very conscious of the fact that people talk about a digital divide. And I'll talk a little bit about that a bit later when I talk about my area, but that's where we're at with our pilot in Merton. Next slide, please.
Thanks, Jen. So within this and within optimal ageing, as Chris said right at the beginning, one thing that we all know is that at some stage we will all die. And I think in the UK, we're not very good at thinking about that, or certainly planning for it. And so I'm just going to start this section by asking you a question. I'm going to give you a couple of minutes or moments just to think about your answer. And that is, what matters most to you at the moment in your lives? What's most important to you as you are at the moment? Next slide, please. And then a similar question, but what would matter most to you if you had only weeks to live? What would be most important to you then? And I've asked a lot of people these questions, and there's always a bit of a theme with some of the answers. Lots of people talk about the people that are important to them, so family or friends or loved ones. Some people talk about place, so where they'd want to be. And I think what we can say that we've just done together, or in your own heads, is a bit of thinking about preferences for your end of life care. And what I'm hoping is that we can translate some of those thoughts and preferences into some plans. Next slide, please. Because as I said, we're not very good at doing it. So Age UK found that 70% of older people felt comfortable talking about death and dying, so the majority. But Macmillan, the cancer charity, did another survey and found that only 8% of people with cancer had spoken to their healthcare team about death and dying. And that's people with any kind of cancer, so any stage of their cancer journey. So there's a big divide there. We know that most people are comfortable talking about it, but we're not having those conversations. And I've been trying to think about why that might be and what I as a healthcare professional can do to help that. Next slide, please. And there's loads of different planning for end of life. I've been doing some interviews and some focus groups, including Chris, and there's lots of things that we can do to plan ahead. Some of them are more practical things, so writing wills, lasting powers of attorney, things like advanced decisions to refuse treatment, some people have. There's also funeral planning. And then there's things that are a bit more of a medical theme that I get more interested in, things like the do not resuscitate form, and also thinking where you might want to be at the end of life. And I've been interested to know what people in Merton think about this. And I've been conducting all these interviews. And what I will be doing is writing up a report based on what we're finding. Because I think as healthcare professionals, we have our opinions on what we think is important to other people and how we think people can plan for that. But what I'm learning is that actually speaking to people, perhaps we're not quite getting it right. So I wonder if I could just, I think next slide, please. Yes. I wonder if we could have a discussion now, if any of you felt comfortable to talk about what you think about some of this planning for the end of life. What would help? Who would you want to speak to? And I'm also just going to ask if anyone would be comfortable or happy to talk to me one-to-one at another time. I would be really grateful to hear just as many opinions from Merton as I can. So I don't know if anyone's got any comments just now on this kind of topic.
Okay, Elizabeth, we'll go to Elizabeth Lane, yep. We'll go to Tony Edwards and then George McGilvray. Elizabeth.
Hi, Phoebe, I'd be happy to have a one-to-one with you. The last 2 years have been quite a challenge, difficult, tricky, exhausting. I've buried both my parents and closed down a company, sorted out my finances, did lasting power of attorney. I haven't done everything on your 6-box plan, but it's certainly something which I'm heading towards. Not quite there yet. And having sort of been with my parents, it's certainly something that, I mean, luckily the healthcare treats elderly people with the utmost dignity and they're very respectful. Because when your body collapses, it's not always the prettiest sight. And it does make you a lot more open when you see the physical frailty. You talk a lot more than about your mental frailty. It sort of goes hand in hand. And certainly I'm a lot more upfront and much more comfortable talking about this now. So yeah, certainly it's been an eye-opener the last 2 years, and I'm happy to sort of have any conversation.
Thank you so much. And I think what I hear you saying is what other people have said as well, that actually sometimes having the experience of looking after other people or having other people close to you that die kind of can focus your mind on yourself. So sometimes that can be a bit of a trigger to think about things about your own mortality and about what you would want if you were in that situation. But thank you.
Thank you, Elizabeth. We'll come to Tony, then George and Jill, and then we'll come to Jill. I see your hand up. Tony?
Okay, just one observation or two for the planning for the end of life. Having just filled out the form to renew my driving license, there's a whole thing on that about organ donation as well. And you can either tick, you can have it all, or you can say bits, you know, corneas and whatever you want. I suppose there's a feeling at the end of life, it's all, you've worn it all out, none of it's worth anything, but that, of course, may not be the case. So you might want to overlap, as it were, in those sort of decisions about, apart from the cremation versus burial debate, organ donations and other things as well, as part of the consideration. The other thing under pressure from my wife, because she was talking to various widows, is simply I've got a thing called a daddy's death file, where all the insurance policies are, all the shareholdings, where my wife would be responsible for taking over the estate, all those sorts of things are in the file, because so many of these, I have to say it's sexist, but the women, the finances were generally dealt with by the husbands. and they just never knew where everything was. And then some of these were people who went into the hospital almost second or third of the month and were dead by the end of the month. They didn't get a lot of time to get their act together. So I'm happy to talk to you again as a one-to-one basis, but these were kind of the realities of actually just getting it organized so that it's not a disaster when the inevitable happens.
Yeah, I think you're completely right. And again, that's been another theme, is that kind of, there's the really practical stuff, as you describe, in addition to some of the more emotional kind of social interaction things, about things like where you'd want to be. So I think it's quite useful in my mind, and I found other people had to separate them into two.
Thank you, Tony. We'll go to George, and then we'll come to Jill.
Yeah, I would be also quite interested to speak to you about end-of-life things. In my particular case, I'm single. Not only am I single, but my family is scattered all over the country. And frankly, I have been thinking about end-of-life planning. I've done the will, but the lasting power of attorney, I'm not quite sure how it's going to work, because I've done power of attorney. I did it for my aunt and for my mother. And you need to be local for that, and I have no local relatives. I've also left a letter with a lawyer saying where everything is, which is basically on my computer, and how to sign on. So yes, I can deal with that if my nieces, who are my executors, have to deal with it. But you know, any sort of health emergency, if you're single, is a real emergency, even if the emergency, even the problem is in itself quite trivial. For example, I mean, I sprained my ankle, admittedly rather badly, but you know, there's nobody around. So I think that also I helped my aunt out. I mean, we single people must stick together, but I don't see any relative who can do that for me. So, you know, there are a number of specific problems for single people, and I think I would like to talk. I need to talk to people about them. I need to talk to my relatives about them, but I would also be happy to talk to you about that particular problem.
Thank you, George. I think, and I suppose this is kind of comes back to that last question, is who would you speak to? And I think somebody I was talking to recently didn't think her GP would be interested in any of this. And actually, for a GP, or certainly for someone like a palliative care doctor, it's something that would really, it's something that's on our kind of mental to-do list to make sure that we've discussed it with patients. So actually, if people come to us wanting to discuss things like powers of attorney, or any of these kind of planning for the end of life, or we call it advanced care planning, that's a port of call for anyone. And I think GPs would always be relieved that someone else is opening up that conversation. But yeah, I'd definitely get in touch with you, George.
Thank you.
Thank you, George. And to Jill.
Hello, just to say that both Ray and I would be interested in talking to you. We've got quite a large family, and it would be quite helpful.
Great. Thank you very much. I'll get in touch.
And just with regard to getting in touch, everyone's got their contact details. You want to put something in the chat for people, or
I can put my email address in the chat. Would that be the best thing, or I can send my email address out afterwards?
Okay, both. Yep, fine. Okay, anyone else on this item would like to? Have you finished your presentation as well, Phoebe and Jen? Or
I'll hand over to Jen quickly, if that's okay.
Nick, can I check the timing? How are we fixed for time? Sorry, Nick, can't hear you.
I think I'd get used to unmuting by now. Yeah, we've got about 5-10 minutes or 10 minutes.
Great. Okay. I can scooch through. Yeah. Could we go to the next slide, please? And the next one, sorry. Brill. So my particular focus is about using digital technology for health and for keeping active and keeping fit. So this was just some stats from this year, which I thought were really interesting, because I think people have thought, wow, you know, over the last year and a half, there's been a sea change in how we all use technology, which I think is true to some extent, but actually there is still a big gap. So 3/4 of people between 65 and 74 use the internet almost every day, but actually once you get over that age, only about half are using it. And there's about 40% who just don't want to use it. And and only about 15% want to use it more than they do now. So if we just pop to the next slide, please. So this has kind of informs some of our thinking about this digital divide, and if it's digital inclusion and digital exclusion, but that's very binary. You know, are people either in or are they out? And I think some of those stats from Age UK suggest that that's not the case. So with a group of experts that we've been working with, we actually sort of came up with these different things, and these are things I guess that we want to bear in mind as we're working on projects that look at increasing digital services and offering digital technology for people to manage their healthcare. And so we've done a nice alliteration here, but so, you know, the first thing that we put on that is curiosity. So do people want to use the internet? Is this something that they're interested in? And then having the confidence and the skills to be able to do that, and the connectivity. You know, some people just do not have Wi-Fi. They don't have the internet. They don't have devices. And then there are some things here that we can think about using digital technology to really help with. So conditioning, so influencing that activity that I talked about earlier. Community, I think we're very much preaching to the converted in this group, but there's some amazing scientific and healthcare studies that show that people who come together and have a sense of connectedness and a sense of purpose, it has amazing impact on health and well-being and actual physical health. So Phoebe has a paper that if anyone's interested in reading, we're very happy to send you a copy. But you know, by having social connections, having friends, and being part of your community, it's actually better for you than trying to improve your blood pressure or stopping smoking. I think it's also slightly better than doing exercise, but I'll scooch over that one since I'm a physio. I don't want to let that out of the bag. So can we use digital to bring people together and provide those connections, even though they might be virtual? And then the importance about cognition, so keeping our brains active, and how we know that that's really important. And we know that that's what helps people keep independent and can ward off some diseases and some conditions. And then collaborations, bringing people together across systems, and working together as populations. Next slide, please. So bearing in mind all of that, and we perhaps don't have enough time this evening, but what I'm doing, similar to what Phoebe's doing, is having discussions with people about what they feel about using digital technology. So in particular, I'm really interested in what older people feel about digital technology. And I hate to use that, but there's no other way around it. But people over the age of 65, and what people feel about using digital technology to keep fit and healthy, and to look after your health, and what gets in the way of that and what can help. So I don't know if we've got 5 minutes now, if anybody's got any particular thoughts on that, but what I would really like to do is chat to people. And I think my discussion probably lends itself better to a group discussion rather than end of life planning, which is why Phoebe's having more one-to-one discussions. So if you are members or you run any groups that I could turn up to and hijack your meeting and talk about this and ask these questions and stimulate some conversation, I would love you to let me know, and I'd be very happy to come along, and it would be great to have these discussions. And the idea behind all of this work that Phoebe and I are doing is that we're going to write this up, and it's going to inform the work that we're doing in Merton, and make sure that things that are being developed bear this stuff in mind, and that we're actually listening to what people think and what people say.
Okay, thank you, Jen. Is there any questions for any discussion you want to have right now, Jen? We have got some time.
Yeah, if we've got time, I'd love to hear what people think about this and using digital technology. Do you use it? Does anybody use any fitness apps, or do you track your steps, or do you exercise classes online?
Yeah, I track my steps on my iPhone or my iWatch, and I get points against my Vitality Health account. Not quite sure what I do with it, but
does that motivate you then, Chris?
It motivates Corinna, my wife, and I quite a lot, because she's got an iWatch, which is partly paid for by the health insurance company. If she gets so many points a week, then at the end of the month, she doesn't have to pay for the extra bit. So there's an incentive for her. And obviously, I want to try and get fit again. So I'm trying to do a minimum of 5,000 steps now. I hope to get it up a bit higher. It
Good
also
effort, Chris.
records,
It's probably slightly more than I'm doing at the moment.
it also records, you know, if I go swimming or anything like that, I get extra points. So it's all very good. We have a personal trainer that we have on Zoom twice a week. So again, it records that.
Wow, that's brilliant. Thank you, Chris.
Okay. So I encourage people to do the same.
Okay, we'll come to Claire, then Jill, and then Simon.
Thank you. I mean, this all sounds really, really interesting and really effective, and I'm absolutely behind it all. I suppose my questions to you are, how is this going to be actually embedded in local society? How are you linking into organisations like Age UK Merton? You've clearly engaged with Age UK nationally, but Age UK locally. How are you engaging with public health? And how, I mean, these are fabulous ideas, really, really positive, really innovative and great. How will they actually be able to become part and parcel of our daily lives?
Thank you, Claire. Really good questions. In terms of the digital stuff, we have spent a long time working our way around people in Merton. So we've worked a lot with Rob and Caroline at Age UK Merton. And also we're working with Wimbledon Guild, and we found the contacts in Merton really good, and everybody's very connected. And so we're working with the social prescribing team, who've put us in contact with lots of other voluntary organisations, and we've got a meeting lined up with the I can't remember exactly the name of it, but it's the Polish Families Association tomorrow. So the idea behind that is from the digital side of things is that we the way that we build community and embed this through the digital platform is that we have lots of local stuff on there. So this, you know, it's relevant to people locally, so that when they go on, there's information from Age UK about how you could volunteer, about activities that they're running, similarly with Wimbledon Guild, and we're at the very early stages, so it's quite rudimentary at the minute, but the idea is that we'll have all of these organisations who have access to the platform and will be able to reach people directly through the platform. So it will bring people together and it will build connections, because these organisations will be able to reach lots of people directly. In terms of how it's embedded, we're really early stages. So I mean, we're just about calling it a pilot, but really it's a prototype. So we've got, as I was saying, we're aiming to get about 400 people involved, and if what we find is working, and if we depending on what the learning is that we get out of this, so we can roll it out across more GP practices across the borough, and certainly the trust that Phoebe and I are working with, it's not a primary care trust, it's a community trust. So we deliver community services in Merton, but they have the foresight to want to invest in this and to roll it out. So we're really early stages. Where it will go, I can't guarantee. It depends on how, you know, how successful it is and whether people engage in it. But there are lots of plans afoot for rolling it out more widely if it seems to be a success. So we're trying all the stuff that you mentioned is great, and we're trying all of that stuff now. Okay. Does that answer your question?
Thank you.
It does. I think. I mean, it sounds fantastic, and I suppose my worry always over something like this is that you and Phoebe are sort of time limited in some ways, and what happens after you move on. So yeah, that's my concern.
We have the same concern, Claire, and we're doing our utmost to put sustainability in place. But there's lots of investment behind this, and also there's from the digital side of things, there's financial investment behind it. So there's a will there to get value and to carry it on.
No, absolutely. Good luck. I really hope this comes off. It's really positive.
Okay, thank you, Jen. We'll come to Jill, and then we'll come to Simon.
Well, really, I agree with everything that Claire was saying and putting forward. And I just wonder if local GP practices could promote their own groups as a start.
When you say local groups, Jill, what in particular do you mean?
Well, the sort of things that you're telling us about, to encourage more local people at a particular practice to find out what's going on. I'm just wondering how the wider community is going to find out about this, and perhaps the local GP practice would be one way.
Yeah, I think that's right, and we've been working with the patient participation groups at the GP practices that we're working with, because they tend to be a very energetic and useful bunch of people. So yeah, as I say, with the digital side of stuff, we're not there yet. We want to make sure that we don't want to run before we can walk. So we want to make sure that before we popularize this and socialize it and roll it out wider, that what we've got works. But I think you're right. It needs, in order for this to be relevant and to have an impact, it needs to be at scale at some point.
Thank you.
Thank you, Jen. Simon McGrath.
Hello. Hello.
Hello.
Hello. Can you hear me?
Yes, Simon.
Great. Thanks. It's not quite an app, but something that I wouldn't underestimate how well it works is something like Alexa. I recently got one of these for a 93-year-old relative, and absolutely who has eyesight problems and mobility problems, and it absolutely has transformed their life. They can change the radio channel, they can listen to books, they can do all sorts of things with it. So I mean, it's relatively low tech by the standard of some of these things, but it does absolutely work incredibly well. And I've heard from other people with elderly relatives that it's worked for their relatives as well.
Yeah, I agree, and I've heard similar stories, Simon. And you're right. It is, the tech's high, but the use of it is low tech.
Exactly.
Yeah, there's a lot of scope, there.
Okay, thank you. Any other questions for Jen, or yes, George?
I hate to sound cynical, but I'm a retired IT specialist, and IT systems, which somebody has said, the solution is an IT system, never ever work. You work with a problem and then go through to the solution. And maybe I'm wrong. I hope I am wrong, but it sounds horribly like one of those.
I think it's part of the solution, George, perhaps, is a way of looking at it. So I guess the solution is for people to feel empowered, to have options, to have knowledge. And I guess the digital part of it is one means of achieving that.
Yes,
so it's a means to the solution, perhaps, rather than the solution itself, just one means.
I have to say I'm skeptical. I mean, you're talking about fitness, for example. I'll be in the gym tomorrow. I wasn't driven down to the gym by any app or whatever. I've been doing it for years, partly because of the problems we've been discussing. But you've got to start with the social context first and get people thinking, and then work out how the computer system is going to help you. So I think that.
Yeah.
Okay.
Yeah, I agree with you, and that's so. When we talked earlier, this is the digital part of it. I know I've focused a lot on it because I wanted to hear what people's thoughts were about digital, but it's only one part of the overall work that we're doing. So there are lots of other streams of work going on, and actually the group that we're working with would have been delighted to hear about the parklets, because we're talking a lot about green space and how nature is important and getting people outside and that kind of thing. So it's not just about the digital. So I hear you, and it won't be for everybody, but it's just one of the things that we're doing. It's just that we've particularly focused on it this evening. So we'll see how it goes.
Okay,
We'd be very happy to report back and let you know how the pilot goes.
Okay, look, thank you very much. We'll move on to the next item now, but I'd just like to say to both Jen and Phoebe, thank you very much. I certainly thoroughly enjoyed that, and I will be looking more into it, because I think it has, as you said, with the digital, it's just part of the problem, or solution, I should say. But no, very, very good work. So thank you very much.
Thank you for having us.
Thank you very much. Thank you. It's been great.
Okay, we'll move on to item number 5 now, which is the any other business. And under this item, we've got 3 sub-items. So we've got your Merton, which is going to be presented by Chris Witherington, as well as the Parliamentary Boundary Review, again by Chris. And then Councillor David Dean has now joined us, and he's going to speak to us briefly about Merton Garden Streets. So over to Chris Witherington.
Thanks, Nick. I just got a few slides. I'll run through them very quickly so I don't take up too much of your time. But hopefully you've seen some of the coverage and digitally and press, and you'll certainly see some more advertising over the next couple of weeks. What we've noticed over the course of the pandemic is that life has changed for everyone. And as we think about coming out of that and recovery, we want to get a sense from the communities in Britain about what has changed, what impact it's had on their lives, and what they want to see in the future. It's a chance to update questions we've already asked in the past, but because things have changed. So what we want to do is have our biggest ever engagement with residents, make sure they've got opportunity to give their views. We're wanting to attract anyone who lives, works, or studies in the borough, and use as many channels as we can. Obviously, we're slightly restricted because of COVID. We can't go knocking on doors or putting people in drafty church halls. So that has a digital focus, but we've supplemented that as well. So we've had a telephone survey of local residents, which we've already completed. We're also doing workshops with particular groups, working with our largest sector partners, and then the main exercise is through a digital tool, Commonplace, where people go and respond to these particular things. So what we want to get you to do is have a look at what places are important to you and why. What's the best things about your daily life? What impacts on that? What's in your community? What impact the pandemic has had? How it's changed that daily life? How it's changed how you use local services? And then what are your ambitions for the future? And your ambitions for your local area and your local community. So we've done the survey. We've got the community group conversations happening as we speak. And then the final bit is the Your Merton website, which we launched on the 12th of May, and it's running until the 7th of July. So with the places, there's literally a map. You can go and ping on the map and then tell us about where you've pinged, why it's important to you. You can also respond to what other people have put. So if they've already pinged on something that you like, Cannon Hill Common or Cotton Park, or wherever it is, you can say, yes, I agree with that. Or if they say something negative, you can disagree with it and say, I know it's actually much better. This is what the website looks like. It's pretty simple and interactive to use. Unlike a lot of online surveys, it's not very tick boxy. You're not being asked to agree with questions we've already set. They're nearly all open questions. It's about you telling us your story and what your life experience is. So at the moment, we're in the process of getting people to respond to that website, and the group works as well. Then over the summer, we'll be analysing all that data with a view to getting together an action plan in the autumn, which will then define what we're doing as a council and working with our partners as well over the next year immediately, and then longer term over the next. So what you could do for us, please have a look at the website, go thing it in. You can spend as little or as much time as you ones on it. 5-10 minutes is absolutely fine. You can get a lot done in that time. But if you are stuck with something to do, it's easy to spend an hour reading through what other people have put. I have, but then I suppose I'm supposed to. But there's a lot of fascinating stuff on there. It would also be really great if you can share this with your friends, your family, networks. I know lots of people on the call are involved in local organisations, residents groups, etc. If you are, and if you want images to put out in any newsletters or any communications you're sending out or copy for that, then please drop me a line. Email address is on there, and we're happy to get that. Some of you may have already had emails from me asking you for this, and definitely get reminders. We're really, really keen as many people as possible to take part, and we can get some really, really good information out.
Thank you, Chris. Any questions for Chris on this item? No? Okay, on to the boundary review.
So there's another consultation, although it's not me doing it this time. The Boundary Commission for England has published its proposals for the parliamentary boundaries. They're known as the 2023 proposals because that's when it will in effect go before Parliament. This is the first of a three-part consultation process they're doing. So in the first instance, they put out these proposals and you'll be able to comment on things like boundaries, the names of constituencies, and as in the modern way, they've got a spanking interactive website for that. You can find it at bcereviews.org.uk. I will put that in the notes. Big change locally, which I'm sure will be of interest. There's still a Wimbledon constituency. I think some of the earlier proposals had it merging with other bits, with bits of Wandsworth or bits of Kingston. There's still a Wimbledon constituency, but there are some changes. Cannon Hill ward is proposed to move across to Mitcham and Morden. So it would leave Wimbledon and join Mitcham and Morden, whilst two of the wards over the border in Kingston would join Wimbledon, St James's ward and Old Morden. So some big changes there for those areas. So if you go to that website, you can comment on the proposals. I think it's open till the certainly into August. I think it's open for a couple of months, so you've got a bit of time, but it's worth having a say.
Thank you, Chris. I'm not sure if there's any questions on that item. Tony Edwards?
Just one quick one. Looking at the map, I mean, Raynes Park is sitting in something called Wimbledon BC. What did the BC stand for? For a minute, I thought it was Borough Council, but it obviously isn't.
Which map is that? Sorry.
It's the link that you provided. If we go to the Boundary Commission and look at the map.
The Borough constituency is their shorthand. That's what they call them.
Oh, I see. Because it looked like Merton was disappearing and was setting up a whole new lot of borough councils.
No, they haven't got that far. No, it's just purely for the parliamentary one. The objective is to try and even out some of the population levels across different parliamentary constituencies.
Yeah.
So there's a bit of toing and froing. I think from an administrative point of view, working in local authorities, it's a bit easier if all of the wards are self-contained within one local authority and not across two. But my colleagues in electoral services will have to sweat through the logistics of taking on wards from Kingston and having to manage those.
Okay, there doesn't seem to be any further questions on that item. Thank you very much, Chris. And now we'll move to the final item on the agenda, which is the Merton Garden Streets. Councillor David Dean.
Thank you, Councillor McLean. You can hear me clearly, no doubt. Yeah, good. And I'm sorry I was not on mute when I was berating my child to go and have a shower. So if you heard me shouting at him, I'm very sorry. He had to have a shower. Anyway, Merton Garden Streets. Actually, this is really something that's happening across many cities in Europe. It's turning the grey into green. And it's really coming under the council's umbrella because there are lots and lots of people that are sort of are mini groups, like in Collier's Wood, for example, and in Lower Morden, who are already greening streets. But under the council, cross-party, it was decided to set up a group that was called Merton Garden Streets. And you can see their activities on Facebook. And also there is a website page, which is slightly different. It's called frontgardenfriendly.uk/Merton Garden Streets. So what's happened over the last 6 months, there's been about 15 main volunteers, and they're putting together 3 major things. First of all, education, really, to explain to people why we should try to turn some of the grey concrete in our streets to green. Secondly, they've been providing trees, flowers mainly, but bushes and trees as well, so people can get used to planting again. And thirdly, they're organising people into bigger groups, so there's more and more volunteers. What they want to do once they've educated more people, got more volunteers and provided plants, is find sponsorship and make this more structured so we could do it across the borough. If you do look at the Facebook page, there's about 460 people involved, and it's a very positive group. There's always ideas coming out of it, and really what it's doing is building confidence in that organisation. So there's no doubt that we've lost lots of gardens over the years to cars mainly, or just because people want to concrete them over. And this really is an antidote. The challenge is that the city is concreting itself so fast that really it is a turf war. And unless we do more of this, we're going to have pollution, we may have climate change, and Merton really needs to play its part at the resident level. It's the people power that's going to make the difference. So if you're keen on giving some of your knowledge, or learning something from the group, giving your time, sponsoring some flowers, or planting something, then please go to the Facebook page, Merton Garden Streets, or go along to the website that I mentioned earlier. And it's, as I say, it's a very positive thing. The summer is a wonderful time. There's lots of planting going on week in, week out. And the next joint planting date is Saturday week, the 19th of June, just before Father's Day. So if you're keen to get involved, go along to that Facebook page. If you're not sure, speak to one of your councillors, because, as I say, it's a cross-party group. Everybody's involved and everybody's very positive. And that's it. So are there any questions?
Yes.
Thank you, David. Tony Edwards.
Sorry, I'm only speaking as a landscape architect, and I've written a chapter in a book about trees in paving. This is not necessarily just a case of lifting up a paving slab and digging a hole in it. When we had some tree planting around Raynes Park, I said, can we see the details the contractor was using? And the drawing was dated after they'd done the planting work. So I didn't have much confidence about the quality of the implementation. I think also, presumably every tree is containerized because we're now out of the dormant season. So any tree can't be bare rooted anymore. So we kind of missed the ideal season. So I'm happy to collaborate and say, from my experience of planting over probably 30 or 40,000 trees on various schemes. But I think it's a case of getting it right. You know, we had that problem about plant a tree in 73, plant some more 74, watch them die in 75. You know, if we don't do it right, we're just chucking money away.
So, Tony, very good points. And that's the first thing, I think, starting with people power, is that the people have got the council interested. And in return, the council has provided some structure, some officer time. And one of the 3 points I mentioned at the beginning was education. So through the Facebook page, through the meetings on Zoom, through the website, people are understanding when you can and can't plant things. You're absolutely right. And then what the maintenance needs to be. The second point is providing plants, bushes and trees at the right time of year. So we've got the education, and then we sort of, the theory becomes practice. And then it is just about working together to make sure that we learn and are continuous. And I do agree with you. I mean, I'm sure all the councillors on this call have all had meetings with council officers saying, look, you put the trees in and they've died, or the pit's not big enough, or you're mowing too much or mowing too less. That's just a day in, day out issue. Anybody on the call, I've been trying to get the council not to mow Bushy Road for years. And finally, this year, we've managed it. I've been asking Thames Water not to mow in May. Finally, this year, we've managed it. And we've put down 2 wildflower meadows. And please go along the Chase. Please go along there and see the beautiful cornflowers, the buzzing bees. There's everything going on in the Chase. Go along Bushy Road and see that the bushes are growing. But the 3 points you make are very well made, Tony.
Are the council going to be looking after everything that's planted afterwards? I've heard the council were slightly not too keen on, as it were, having more tree planting, which they had to look after. They were initiative to put all the trees in private land rather than in public spaces. And what's the council's stance on long-term maintenance?
So it's people power, Tony. It's what we do, and it's from the start to the finish. And it's going to be more about flowers and bushes and some trees, but the trees, I mean, the street trees are definitely council only because they're relatively complex. In terms of private land and green spaces, that's trying to work with the friends groups and private landowners. Not always easy. I planted 800 odd trees this year, and it wasn't easy. But the more people we get involved in this, and we've already got over 400, the more things will happen. And absolutely, things will go wrong, but that's not the reason not to do it.
Okay, thank you, Tony.
Absolutely.
Any other questions for Claire?
I was just going to say, well done. I mean, I think Bushy Road is looking absolutely fabulous. Wimbledon Chase is looking brilliant. So great stuff. Well done.
Thank you, Claire. And well done to some of the leaders in this group. Kelly Gunnell, for example. There's many others. Katie Meach. They do an amazing job. And the more of us, the merrier.
Okay, thank you, David. Michael?
Yeah, to me, the council aren't listening anyway, because they've just doubled the parking charges. So what's everyone doing? Concreting their driveways. It's a farce, absolute farce. I've seen more concrete laid than you've planted trees in the area. So what was the point?
So Michael, it's a turf war, and that's why we must do this. These forums are non-political. I can only tell you what we are doing. I'm not here to, see the other side of it. It is a turf war. The more we do, the more chance things are going to be greened. Let's all work together and do that.
Yeah, I know down our road that they've even dug up trees to let driveways go in, which I thought wasn't allowed either. But they're allowing people to put a driveway in to dig up the trees on the verges.
So contact your local councillors. I'm not sure where you live, Michael.
Westway. Westway.
West Barnes, is it? Is that West Barnes?
Yeah,
contact
I think
local
so.
councillors. Yeah. If you're not sure, contact me and I'll put you in touch.
Since 2008, you've needed consent to concrete over your front garden because of the effect on drainage and shunting surface water, which previously went in the ground down the drains. So all these people have been concreting their driveway, should have got planning consent for it since 2008.
None of them have.
Okay.
And also I know that if a tree is 10 years old, they're not allowed to remove it. So what they do is they cut it down, call the council, plant a new one, and then they get permission to have the tree dug up. I've seen that done as well.
I'm incredibly disappointed to hear that, and that's definitely not good. So, David, I think if you contact your councillors, but if not, again, I'm happy to look into that for you as well.
I did. I contacted the council and they acknowledged my email. They acknowledged that the tree had been removed and there was nothing they could do. I even sent them photos.
Well, we can't get overly political, but leader of the opposition, I'm sure I would love to. Enforcement is something that perhaps is not done as well in Merton as it should be. And that's as much as I will say on that. Any other questions for David, or I can bring the meeting to a close and hand back to Chris? No. Okay, on that note, thank you very much for having me tonight. I'll hand back to Chris. If you have any words for Chris, or shall I just end the meeting?
Just end the meeting. I think people will be notified of the next meeting, which will be in September. Look, it may actually be a live meeting.
Okay, there you go. Something to look forward to. Okay, look, thank you very much. Have a wonderful evening.
Thank you.
Thank you.
Thank you.
Bye.
Bye.